Two workers from a pediatric care facility in New Jersey are speaking out anonymously after an outbreak of the adenovirus killed 10 children and infected at least 23 others last month. A report from New Jersey Advanced Media chronicles how mismanagement at the Wanaque may have caused the virus to spread and even denied children the care they needed after they were infected.
Susan Livio is a statehouse reporter for the New Jersey Advanced Media and one of the authors of that story. So really interesting story, Susan. In the story, the workers that you spoke to explained why some of the children, after they contracted the virus, were not removed from the facility. One would think that, you know, the idea of containing and removing the person infected would be sort of an automatic thing. Why do those workers say these sick children were not taken out of that facility?
The workers claim that there was a policy of trying to keep the beds filled as long as possible, because as soon as the children leave the facility loses its Medicaid funding, and that's $519 a day.
Susan, from what I understand, this is one of only 4 facilities in the state of New Jersey that are able to care for children who are in this condition. Was there ever an idea of perhaps moving them to some of these other facilities, or is the risk that they would infect other children at some of those other places?
Sure. The state health commissioner described how that would be very difficult for these children and would put them and other children that they would come in contact if they were moved away at risk. These are children who were born with birth defects, relied on technology to help them eat and breathe, very vulnerable children. And it wasn't an option. They needed to just contain the infection and make it work.
So the aunt of one of the children infected said problems worsened when new owners took over the facility. And this facility has had, you know, several infractions on the books. What sort of changes did she observe?
She claimed that there was a difficulty with keeping the staff up to snuff. She claimed that there was concerns about the place not being clean. She talked a lot about people working as hard as they absolutely could, but in the end, the facility just wasn't the same when it changed hands from 2014 to the present.
And one of the employees said administrators at the center may have been concerned about the Department of Health finding out about the outbreak. I mean, could there be an investigation and potential consequences coming for the Wanaque Center?
The State Health Committee is going to be investigating and is holding a hearing in Trenton on December 3rd. At this point, the only investigation is that of the State Health Department. And right now, they are looking at the outbreak. They're not looking at the decisions made by the doctors or other personnel. They're just trying to keep it under control. There may be fines. Last night, the health department required them to shut off all admissions, both as for adult patients as well as pediatric. They required them to hire a pediatric infectious control specialist and a physician board certified to deal with infections. Whether there'll be more fines, we're not sure yet. It's still early on. There was still 4 cases confirmed this weekend, so it's not in control yet at all.
Okay, that's a question I was going to ask you.
Yeah.
Not in control.
I mean, real quick, Susan, in the last 15 seconds that we have you spoken to some of the parents? I mean, I would be scared to death if my child was still in this facility,
and
knowing
vulnerable,
that
so vulnerable.
Yeah.
We have spoken to some of the parents of children who passed away, as well as children who remain. They know that their options are limited. And they're very afraid. They're really counting on the state to get this under control, and they've lost some faith because this has been going on now for almost 7 weeks.
Wow. Susan Livio, thank you for your reporting. Thanks for joining us.
Thank you for having me.